We always roll out the red carpet for our friends over at the Guam Regional Medical City for our healthcare, your healthcare partner. This is an opportunity for you to listen in on some of the services that are offered by GRMC. And sometimes it's kind of like tech talk. You know what I mean? It's the anatomy of everything that helps you better understand, what's going on, how things are ticking and moving and what it needs, what your body needs. And sometimes it's external, and that is patient education. And the manager is here. Can I call you Melliza?
Yes. Good morning.
Melliza joins us in the studio this morning. She is the patient education manager. Hello, Mila Young. How are you?
I'm good.
Merry Christmas.
Merry Christmas to you too.
Thank you for coming in. Move that camera to the pretty people. And of course, Cindy Hansen, who's in charge of communications at GRMC, also flanking her today. Thanks for coming in and
good morning.
being a part of the gig today. I like that.
Yay. I'm on the radio. I'm on the radio.
Yeah, she's such a stranger to radio. She's like a fish out of water in here. She has no idea how this thing works.
No What
clue.
is this thing?
Yeah. So Cindy Hansen has hooked us up with Mila today because we were talking about patient education, a large component to understanding what you need in healthcare. Yes, Mila?
Yes. And so patient education is essentially giving you the information you need so that you can make the right choices for your health.
Okay.
And it doesn't start and end with your doctor. It will continue like throughout your encounter with the healthcare system. So whether it's going to be your nurse, the pharmacist, the lab technician, and of course, when you get admitted at the hospital, that's with us with the patient
So
educators.
everything that has to do with your health care,
Right.
there is some education about what it is, a next step. Where do
Yes.
I go from here, kind of thing. So, like you said, I mean, it can be in any any element, any component, like you said with talking to a pharmacist, speaking with the nurse. I'm interested in the fact that you come in very handy, and there's an important piece of education when it comes to being diagnosed with something.
Yes.
And so you have to have some wealth of knowledge on each of these different conditions. You could be like a doctor, couldn't you?
Actually,
Yeah.
actually,
Yeah, so
You
I
are?
am, I am
Mila is a
physician by
doctor.
I was
training.
going to say there's no title here that would suggest that you have a title that matches the wealth of knowledge that you have to have about diseases.
Yes, and having that wealth of knowledge, I feel obliged to be able to share that.
Yeah.
And share that in a way that is better understood by our patients and our community.
Yeah.
So I'm really very glad for that opportunity to do patient education in the hospital.
So it's a service that's offered, and are you recommended by physicians maybe in a scenario where somebody has a precondition maybe?
Yes.
Okay.
So the way it goes with when you get admitted to our hospital, and so depending on your condition, if you're newly diagnosed or you have a chronic condition, or you've been readmitted, or the doctor would just want you to get reinforcement on certain education concepts, then the patient gets referred to us. And so we see them while they're in the hospital, and we encourage them to continue seeing us even when they're already discharged to home. And again, like what I said, education is continuous. Their chronic disease doesn't get cured after they leave the hospital. It continues on with their lives. It also affects their family. And so really getting that guidance from us educators who have a very robust resources that we use in the hospital, which is also used by our own medical staff or healthcare professionals. And again, we're able to deliver it to them in a manner that they're able to understand and apply to their own care.
It seems to me that there is then a fine line of support between education and actually offering some sort of counseling in that area. I'm assuming you cross the line often on this.
Yes, more or less. So our services is more of informational and letting them know that these are the guidelines, this is what we feel could help you in your care. And if they're having some issues and communicating it with their doctor or with their family member, we help them also in creating that question on how they can communicate their wishes, their concerns.
So you do kind of come under counseling in some
Yes.
form. Does that interact with any other service in the hospital where stuff like that?
A lot,
Okay.
yes.
Okay, so counseling and education, there's recommendations all the
Yes.
time about how far that you can go.
Yes, and what we focus on that education counseling is how them as a patient would use that information to decide for themselves, because they're the author of their own care. Whether or not the doctor tells them you gotta do this, you gotta do that, but if they decide not to, then it's gonna be their decision. But our role
Yeah.
is to
Is
provide
to provide the information
Yes.
that will arm them with the best
Right.
decision for themselves. But you're in no position to say,
Yes.
we really think that you've made a bad decision here. Okay. And sometimes I guess that could be frustrating when you're armed with the knowledge and somebody decides that that's just, either it's too cumbersome or too expensive
Right.
or whatever the issue is. Okay. Well, then, I thought that this was a really good question, by the way, this Cindy. How does patient education help people keep their New Year's resolutions? Ding, ding, ding. We are in the territory of resolutions that a lot of people give up within the first 3 months of making them. I guess that's a good question. How does patient education provide the confidence for somebody who wants to make a New Year's resolution, keep with it? Because usually it has something to do with their health. Yeah.
So it all starts with knowing what you want to do. So like having an idea of what your goal is, say for the next year, and then because me and the other my fellow patient educators have been trained in self-management. We're trained facilitators in self-management, so we help you get to that details to be able to reach that goal. Like, what are your small steps to reach that big goal? So a good example is most people would say, I want to lose weight next year. But how do you lose weight? Losing weight is the effect. What are the little steps you need to do to lose weight? So we talk about physical activity, we talk about nutrition, we talk about stress, and it's hard to do all three things in one time. And so again, we ask them further, what is it that you want to do first? What is realistic for you? What is achievable for you? And as we go along in our, say if they decide to continue getting information from us or our guidance, then we, as long as they're able to make it eventually a habit, because one of our mantras in self-management is any new activity, give it a try for 2 weeks, and there is a psychology behind that, so that eventually it becomes a habit, so that when you take on new activities or a new habit, it's going to be easier for you because you're already doing that first.
You're sort of
goal.
training yourself
Yes.
for a drastic change.
Yes.
Well, I guess losing weight is like one of the number one things people vow. Then they get gym memberships. I mean, I talked to gyms last year, and they say, the knockoff rate in the first 3 months is, and now that they've got programs where you can get a reimbursement. I mean, I'm sorry, that you can get a incentivized, that your fees will be waived or something like that. So it makes people want to go 10 times in the course of a year to visit the gym to keep their membership. But on the flip side of that, the psychological stuff is the hardest, it seems to me, because the laid out map on healthy lifestyle is all there. The food pyramid exists, and so healthy eating and making those adjustments seems to be. Finding the healthy choices seems to be an easy one. It's just what those triggers are.
Yes.
Right? That
And
make you succumb to whatever it is that you feel
right.
is
And-
necessary.
Yeah. So this is where another self-management skill would come in, which is what we teach in one of our workshop, and we call it problem solving. So meaning if you are dealt with like a dilemma, how are you going to deal with it? And so there are different scenarios. So one is you could maybe, if you have one particular problem, say for example, if you're having a hard time falling asleep, okay? And so in in our workshop, what we do is we talk about, we brainstorm. So we get different ideas from participants, and then whoever had posted that problem, we ask that person, which one would you like to try? And if that doesn't work out, which one are you going to try next? So until you're able to exhaust all resources. And
Until you
sometimes-
you run out of answers. Yeah,
Yes.
yeah.
And then sometimes, so sometimes the problem may not be solvable at all. So,
Right.
and I guess you might try to redo the whole thing again, or maybe move on to another problem that is probably causing that problem that you have.
What is really the base of the
Exactly.
issue? So, because I've always thought I hate dieting. I just loathe the process of dieting because it always feels like you're giving up something, and I really feel like you should be able to do it all, balance it all. Balance it all. I guess that's the big thing. To be able to do whatever it is that you want to do, and cut back if you have to, but do it all so that you're not depriving yourself of anything. And doing it all means that you have to keep up with some sort of regimen.
Like a prep meal.
Something like
Yeah.
that, prepping meals, committing to the exercise. That's always the big thing, burning fat. But anyway, women could write books, on failed diets. Yeah, alone. There's no question. But you did said something about sleeping. And I just told you, is there a resolution to what I just told you about a condition I had this morning? I was just telling her this morning that I woke up at exactly 1:38 this morning. Yeah. I'm always thinking, what is Bob doing? He's probably snoring, because I always measure the time that I wake up to whether or not you're already up and making your way into work. And I'm thinking by 2:00 in the morning, you're already starting your morning routines, right?
1 cup of coffee gone, yeah.
By 2 a.m.
Yeah.
See, I was right. At 1:38, I woke up, and then I couldn't go back to sleep. And I started psyching myself up. We all know this, right? You psych yourself up because you do the math and back time, how much time you think you have before the alarm will go off. And in this case, it would have been like 2 hours and about 7 minutes. And so I was like freaking myself out, like I have 2 hours and 7 minutes. If I go to sleep right now, I could make it happen. And then you toss and turn because now you're worried that you just can't go back to sleep. Does counting sheep work?
It does for some.
Right?
Yes. And what other people do is that if they woke up from their sleep, they get out of bed.
Yeah.
And when they feel like they're sleepy again, they go back to the bed. So
Oh.
again, you kind of like prime yourself that you only stay in bed when you're ready to sleep.
Okay.
Yeah.
Well, that was a good one. Sometimes I just do it. I just close your eyes like a child. Just close your eyes and stop. And then relax every muscle in your body. Right? You
tried
do
that, yeah.
Relax every muscle in
Right.
the body. And you don't realize how much you're stressing until you decide to relax. And then you go, oh, no wonder I'm still awake. So only go to sleep only use the bed to go to sleep.
Yes.
That's smart, because if you stay in bed longer than you're supposed to, then it's no longer special. Here's the other thing: do not play Candy Crush.
Yeah.
That's a stress.
In bed.
That's stressful. In bed with
Yes.
even
You're
if
not
you-
supposed to
you-
take your cell phone in your bed at all.
chambers at all.
Right.
I do.
Me too.
And I hear it popping off every night. At several hours during the day. Sometimes I could sleep right through it. But anyway, you've got to retrain your brain, and you can help us do that.
Yes.
Okay. Now, are you available, or you have to be recommended by the doctor? That's within the providers network.
So right now, all our education resources is open to everyone. So it's available to the public. And so if people would just need to get a print material or like a link to an education video that we also provide, they can call our office or they can walk into our office. So we're open from 9 a.m. to 5 p.m. Mondays to Fridays.
All right. What's the number to call?
So they can call the hospital trunk line, so that's 645-5500. And we have 3 different extension numbers to our patient education office. So that's extension 3685, 3687, and 5688.
Boy, that just sounded like bingo right now. Okay, or raffle tickets. Just call the main switch line, and then they'll be able to patch you through over to the patient education office and ask for Meli or Melliza Young is who you should ask for. Thank you so much.
Thank you.
Dr. Young, who knew? I was thinking that doesn't, I mean, you had to have had the kind of credentials in order to be able to impart the knowledge, right? Yeah. Well, you're so modest about that. Well, thank you very much. Cindy, thanks, Ellen. Again,
You're very
is there
welcome.
anything else that you want to bring up?
Yeah,
before?
just real quick, the second most popular resolution that people have is to quit smoking. And we have our smoking cessation program, which starts again, the first program will begin on January 9th, 2019. It's free and open to the public. So again, you can just call 645-5500, which is the GRMC main line, and ask for patient education, and they'll be happy to sign you up, and you can start your new year smoke-free.
Wow, how about that? How long does it take generally?
It's a 4 weekly session, 1 hour each.
Okay.
So again, we try to develop that habit of slowly cutting down, or if you're the type who could torture yourself by cold turkey, you can.
I know some
get
people
into it.
who are committed enough that they do that. It's just the triggers, you know. And
So we
then
teach that too.
Yeah, absolutely. Sitting in bars and staying away from food. 2 triggers for smoking. Thank you so much again, Melliza. It is now about 8 minutes before 10 o'clock. That was your healthcare partner, brought to you by the Guam Regional Medical City.